Hepatitis B vaccine guidelines shift. What parents need to know: recent changes to hepatitis B vaccination recommendations by the Centers for Disease Control and Prevention, CDC's advisory committee, have created confusion and raised concerns among parents and medical professionals. The committee, recently reshaped with new members, has moved away from decades of established practice, altering guidelines for newborn vaccinations. The new recommendations suggest delaying or skipping the birth dose unless the mother tests positive for hepatitis B or her status is unknown. This shift raises questions about public health and the potential for increased infection rates. The science behind the birth dose: for over 30 years, the hepatitis B vaccine has been universally administered to newborns within 24 hours of birth. This practice has been overwhelmingly effective, reducing chronic hepatitis B infections by 99%. The virus can lead to severe complications, including cirrhosis, liver failure, and liver cancer, which have a less than 20% 5-year survival rate. Vaccination protects against these risks, especially as the risk of chronic infection declines with age. The new recommendations: a complicated approach. The updated guidelines now recommend only vaccinating at birth if the mother is infected or her status is uncertain. If the mother tests negative, vaccination is suggested to be delayed for at least 2 months, with no clear scientific justification. The committee also proposes antibody testing after the first dose, adding unnecessary complexity and cost. These changes assume universal access to prenatal care and testing, which is not realistic for many families. Why this matters: transmission and community risk. Hepatitis B can spread through contaminated surfaces and household contact, meaning even asymptomatic carriers can transmit the virus. Approximately 10% of infections occur outside of mother-to-child transmission. Reducing vaccination rates will inevitably increase the risk of outbreaks and expose more individuals, especially young children, to infection. What should parents do? Given the available evidence, experts recommend continuing to request the hepatitis B vaccine for newborns within 24 hours of birth. This approach remains the safest and most effective way to protect against long-term complications. The vaccine has a proven safety record, and delaying or skipping it introduces unnecessary risks. The new recommendations add complexity, potential costs, and trauma to an already stressful time for new parents. The shift in guidelines appears to undermine decades of scientific consensus and could reduce overall vaccination rates. Maintaining the birth dose is the most straightforward, effective, and evidence-based approach to preventing hepatitis B infection.